Right, happy Monday afternoon here with Josh and Paul and Deirdre and Jason Schwartz, who you'll hear from in a minute. He was a co-chairman of our scientific committee, Yale School of Public Health, and an expert on vaccines, which, as you can imagine, is quite relevant today. Let me just give you quickly where we've been since Friday. So these are 3 days of numbers. Basically, I think what you see is the positivity rate stays quite low. I think it's about 2.6 for the 7 days. Hospitalizations at a probably 4-month low. Average daily fatalities still too high, but continuing to trend lower. And these are all reasons to make sure that we believe that we're making progress in the war against COVID. And that's why on Thursday we're going to be able to make some announcements in terms of our cautious reopening, in terms of capacity for our stores and our restaurants and our retail and personal services. You'll hear a little bit more about that on Thursday. The vaccine update. 75% of our people 75 and above have been vaccinated. As you know, after you get about 70% of the people vaccinated, it gets a little tougher to get the other 30%, but we're continuing to make progress there. Over half of our people 65 to 74 have been vaccinated. 39,000 doses of J&J are arriving this week. That's important because, as you know, we opened up to 55 and above today. As you can imagine, the phones were very busy. The websites were very busy. Most of the slots filled up quite quickly within a few hours. If you called 211, you're still going to be getting some calls back, over the course of the day. But this is, with these new doses arriving, there will be additional appointments available over the course of the week, so keep your eyes open on that. 156,000 total doses in this week. I know, as you remember, just from a month ago, we were at about less than 50,000 a week. 156,000 is a lot. We're not positive we're going to keep that high number up over the course of the next week or two, but we are tracking this very carefully. 964,000 total doses administered to date. And that doesn't include what we have in the Veterans Administration. That doesn't include what you have with the tribes, which get a separate allocation. So probably over 1 million people in the state of Connecticut have received their first vaccination shot to date. What does that mean? First of all, there's been a lot of talk about how fast we get people vaccinated and what does that mean? And does it mean too much? I don't think so. As you can see, from the chart on the right, the United States, about 15% of the populations across the other states have received about their first dose, their first vaccination. In the state of Connecticut, it's almost 20%. What does that mean? That means we have 160,000 more people in Connecticut who've been vaccinated than would otherwise be the case based upon the national average. 160,000 people. That saves lives. That keeps people out of the hospital. That stops the spread. And as you know, we continue to look at those variants. It stops the spread, gives us a better chance to keep our schools open. Our schools are more likely to be open than anybody else in the region. Allows us to continue to reopen our businesses. More on that on Thursday. And what that means for jobs and what that means for getting this pandemic behind us. The next chart, Max. Speed also has to do with simplicity. And simplicity has a lot to do with equity. Sometimes there's considered a false choice between speed and equity. But first of all, simplicity means that nobody can cheat the system. Simplicity means that there are no line jumpers. You can't go to linejumpers.com, or you see from Seattle, line jumpers dodge the Washington State eligibility rules. CBS Los Angeles, vaccine line jumpers heading out to hard-hit communities, using access codes wrongly to jump ahead of the line. USA Today, cutting, bribing, stealing. If you're one of the folks lucky enough to have a doctor, you can probably get that signed doctor's permit that you have the comorbidity. If you're one of the 20+% of folks here in the state that don't have that, that's not something that you can do. So I do think that simplicity also means a lot in terms of equity. You probably saw that funny skit on Saturday Night Live for the opening on this past weekend, where a number of people were pretending to or learning how to smoke again so they could claim smoking as a comorbidity. Next chart, Max. Simplicity means equity, and it also is in the interests of public health. And by categorizing by age, that prioritizes public health. You know, we've had 7,600 fatalities related to COVID over the last year here in the state of Connecticut. And, you know, the vast majority of them are people over the age of 65. And, you know, 3/4 of those, or over half of those 65, have been vaccinated. You see what a difference that's making. But you even see in the younger age groups here that, you know, 55 to 64, you're probably 20 times more likely to suffer complications, 20 times more likely hospitalizations and fatalities than those in their 30s. So it makes an enormous difference. So age prioritizes public health, and age is simpler, and that means equity. And finally, we reinforce our particular emphasis and make sure that no disadvantaged, underserved community is left behind. And these are communities that have suffered the hardest over the course of COVID, and some of the communities that it's not as easy for them to get vaccinated. So our goal is to make sure that we have everybody equally vaccinated across our great state. So we're working closely with the federally qualified health centers, the hospitals, the pharmacies, the local health departments. And we've gone to the 50 most disadvantaged zip codes in the state of Connecticut. Disadvantaged meaning based on poverty levels, based upon dense housing, based upon multi-generational housing. Those communities where you're most likely to have the spread of the virus, and sometimes those very same communities are less likely to get vaccinated. So A, we're reaching out aggressively to those communities. We're going to allocate 25% of the vaccine to those communities to make sure they get vaccinated, even if we have to work extra hard to make sure they get vaccinated. Look, Deirdre and Josh and we've been out there working. It was at, you know, Waterbury, there at the Arts Magnet School, signing people up, what they're doing to get people vaccinated there. Just this last Friday, down in Bridgeport, meeting with many of the ministers, each of whom was back in the pulpit preaching on a Sunday, emphasizing the importance of getting vaccinated and where you could get vaccinated quickly and how you could get vaccinated safely. So we're working very closely with our provider community to make sure this is a priority as well. That just gives you a quick update of where we are one day into 55 and above. More vaccines to come. More slots are going to be open. I know there was some frustration. A lot of people at the front door all trying to squeeze through at 12:01 this morning or 8 a.m. this morning. But we've got tens of thousands of people who have made their appointments already. You know that, Jason, I just love it if you could say a few words about, in particular, the vaccines. We just got the J&J approval. We'll be getting 39,000 doses over the next few days. What that means to people, how they should think about it, and basically our vaccination strategy. Jason Schwartz.
Sure. Thanks, Governor. It's great to be with you on another milestone day, I think, for the vaccination program in Connecticut, not just because of the expansion to this new group of residents of Connecticut and to the teachers and child care providers, but also because of the Johnson & Johnson vaccine, which we'll now have available within these next coming days and be able to add to our vaccination program. The Johnson & Johnson vaccine will give us now 3 vaccines, all of which are highly effective at preventing those severe outcomes of COVID-19 that we're all working so hard to prevent: the hospitalizations, the ICU admissions, and the deaths. The Johnson & Johnson vaccine has shown very high levels of efficacy against those cases of severe COVID-19. And in fact, a month, 4 weeks after individuals received that vaccine in the clinical trial, there were no hospitalizations as a result of COVID-19, and there were no deaths. due to COVID-19 among individuals who received the vaccine in the clinical trial. So this is a fantastic vaccine. We have 3 fantastic vaccines, all of which are also remarkably safe. The safety story for the J&J vaccine is fantastic. This is a vaccine that our science subcommittee of the Vaccine Advisor Group has been following, as we have throughout the vaccine story over these last several months. And in the last week, our science subcommittee, we were looking at the same data that the FDA advisors were reviewing, the data from the manufacturers, the data from the FDA scientists. We met over the weekend as well to discuss the data, discuss the vaccine, and our science subcommittee was thrilled with what we saw about the J&J vaccine, and we're glad that we're going to have it available. So we now have 3 vaccines. They're all fantastic, and the opportunity for now the vaccination program here in Connecticut to accelerate with the added supply, with these added vaccines, and the opportunity for individuals to receive any vaccine that's available as soon as it's available and as soon as it's their turn to do it, I think is really the important message as we enter this new phase of the vaccination program. So I think that's where we are with the J&J vaccine, and I think it's an exciting new addition now to our toolkit as we move forward.
Well, Jason is sticking around to answer your questions, as are Paul and Deirdre and Josh and myself.
NBC Connecticut.
Good afternoon, Governor. Matt Austin with NBC Connecticut. Just following up with what Jason was saying about Johnson & Johnson. In terms of this vaccine, how is it going to be distributed here in the state? And will people have a choice, basically, of which vaccine they receive?
Josh, you want to take that?
Yes. So all of our providers are going to be making visible in the reservation process which vaccine is associated with that appointment slot. So we want people to have visibility and transparency into what vaccine will be available. And so over the weekend, the team was working in preparation in anticipation of the approval of the J&J vaccine over the weekend to survey our providers, see who would express interest and capacity to be able to take on J&J vaccine this week. We actually received far more requests for J&J than we had even the 39,000 doses that have been allocated. So that's great news. And our fantastic team at DPH worked through the weekend, got the orders in last night as soon as they were able to be ordered. Those should be in transit as we speak. And it's actually going to enable, in many cases, us to bring forward a lot of those educator clinics that may have had to be pushed further out into later in the month, be able to bring some of those in even sooner and provide a lot of additional access across the state, new appointments that'll be opening up in the coming days to help deal with the hundreds of thousands of additional people who became eligible today. So great news.
And Governor, I know you were kind of referencing the frustration some people might have felt today when they were trying to sign up and register for a vaccine appointment. I'm wondering what you want to say, I guess, to them in terms of when things should even out a little bit and when they should expect to be able to find more openings.
It'll probably take a week or so. So I urge you to be patient. If you can telecommute or you don't have any great urgency there, give others a chance to go forward. I think that would be certainly appropriate. But look, I think we've got about 500,000 people all going for those 100,000 doses. So you can see there's going to be a bit of a line right now. But if we had done it the other way, we would have had about 1.8 million people all trying to go for those same number of doses. So it's going to take a little bit of patience, but I think it'll sort itself out over the next week or so.
And finally, any update on the travel advisory?
We're going to be making some announcements on that on Thursday as well, but we'll be opening up the travel a little bit more, trying to get some confirmation from my fellow governors.
Okay, thank you.
Channel 3 Eyewitness News.
Yes, Governor, the state is committed to the age-based rollout, and in an effort to accommodate everyone who does want a vaccine, you indicated that speed is really going to be crucial going forward. So I wanted to ask about the state's stance on extra vaccines. For example, these are the ones that may be discarded at the end of the business day at a pharmacy or a clinic. Is there any guidance for these clinics or pharmacies that find themselves discarding doses at the end of the day?
Deirdre, I hope we're not discarding many vaccines at the end of the day.
No, we have as we've been saying all along, we have a policy of use the vaccine you get within 9 days of receiving it and no dose go to waste. And every vaccine provider is asked to have a process in place for what to do with doses at the end of the day and work backwards through our eligibility groups. We also have a requirement that they notify us of any wastage, and we are not hearing about wastage of vaccine. We are hearing about some providers that have a few doses left at the end of the day, and they're administering them to volunteers. But we are not hearing about doses that are being discarded. And our vaccine providers, for the most part, treat this like the precious commodity that it is.
Yeah, absolutely. So, I mean, there should be like a waiting list of sorts for certain pharmacies to kind of go through that list.
Yes, as part of the provider agreement, providers are setting up processes to make sure that either they don't open a vial at the end of the day if they don't have enough people to give it to, or they have a way to use all the doses at the end of the day.
And with more shipments coming in, are we expecting to expand hours at vaccine clinics or pharmacies?
We ask our providers to use all the doses they get within 9 days of receiving them. So we do anticipate that some of them may be expanding either weekend or evening or both to get all of the doses used that they're receiving this week, since we're getting such a large shipment.
Thank you very much.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. I believe we're seeing maybe the biggest rush to get vaccinated out of this age group today, those ages 55 and between 64. Considering the population of that age group in Connecticut and the average number of doses the state has been receiving, I think many want to know, what is an estimated time frame for how long it could take for majority of this group to be vaccinated?
It depends, obviously, on the number of vaccines we got, but let's assume we're going to be able to ramp up slowly from, 100,000 plus every week. We've got a cohort of, say, 500,000 in that age group, and maybe 70% are going to want to get vaccinated. We'll see what that time is, at least over the next few weeks. So we really think that over the next 3 weeks, we'll be able to go to the next age cohort.
Somebody please jump in. This is.
I think they're obviously having some technical difficulties in the press conference, so please stand by.
Yeah, we're back. Are you guys back?
We're back.
Zinnia Maldonado, Fox 61.
Josh, I believe, I don't know, do you want me to repeat the question, or I think you?
Sure.
Okay, so basically I was saying that it seems like we're seeing the biggest rush out of this age group, 55 through 64. And considering the population of those in that group here in Connecticut and the number of doses the state is receiving currently, many want to know, what is an estimated time frame for how long it could take for a majority of the group to be vaccinated?
Governor, do you want me to take that?
Sure.
Okay, so as the governor announced last week, we expect this phase to take about 3 weeks till the next phase on March 22nd is when we expect to move forward to the next phase. Based on the supply of vaccine that we're receiving, the number of people eligible who have not already been vaccinated, and estimated rates of how many people who are eligible will want to take the vaccine, we're very confident that anyone in the 55 to 64-year-old age group who would like to get a vaccine in the next 3 weeks should have that opportunity.
And then, we heard from a lot of people that weren't able to make a vaccine appointment, but do you guys have a number of those, of the total number of individuals who were able to schedule a vaccine appointment today between that 55, that new age group?
We don't have a precise number yet. Providers are working through their backlogs. We know it's in the tens of thousands of people who booked appointments today. And as the governor alluded to, there'll be a lot more appointments coming online in the next couple of days as well. Many providers were just finding out about today about their Johnson & Johnson allocation, so they're going to be in the process of adding those. Many of our pharmacy partners are finding about their allocation for the week, so they'll be adding more appointments there. We got our first installment of the federal program providing vaccine directly to federal qualified health centers. So there's a bunch of appointments that will be added there. So as the governor said, please be patient, keep checking back each day, stay calm. You'll get your appointment in the next several weeks.
Thank you.
News 8.
Good afternoon, Governor. How are you assigning priority for the delivery of the vaccine between the teachers' clinics and the general public 55 and older? Are you having to make choices?
Well, we have a set aside, as you know, for the most socially vulnerable communities, and that's about a 25% allocation there. And then the bulk are going to the 55 and above, but again, a separate allocation for the schools as well. We're allocating to each of the departments of public health spread across over 100 different towns, and they're working with the schools in terms of how people get vaccinated. Either there'll be a separate lane for the educators there, or we'll go right to the schools with the vaccine.
Do you have a breakdown of how much vaccine is headed to the 55 and older, and then how much is headed towards the educator?
Do you know that, Josh?
No, not precisely. The educators' clinics, remember, will be phased in over the course of the month. So about 100 of our school districts are going to have at least one clinic starting this week, but it's not going to be going through the entire population the next week or the next two. So also in that category, we're asking people to be a little bit patient.
Thank you.
News 12, Connecticut.
Hi, Governor. I'm just curious, since there are so many people trying to sign up in this 55 to 64 age group, in hindsight, is there any thought that maybe it would be smarter to break them down into 5-year increments?
I think you're going to find, John, I hope that over the course of the next few days, over the next week, it sorts itself out. You're right. You can slice it, even dice it down to a 5-year increments. I think we're going to be okay. It'll depend on what % of this population really wants to get vaccinated at the end.
I think it might be a good opportunity to reflect, John, on if the reality is that if we had continued down the prior path on prioritization, we would have somewhere between 2 and 3 times more people eligible today than we do as it is. Based on those various lists, we would have had probably 2/3 to 3/4 of the entire adult population eligible today. So based on this new age-based approach, as the governor showed on that chart, this group that's coming eligible today are the group that are by far the most likely to die from COVID-19. They now have the clearest run at appointments over the next 3 weeks. We get them vaccinated and we can continue moving down the list. So I think it's a good example of why the change to an age-based approach made a ton of sense.
So, Governor, I know on Thursday you're going to announce some more loosening of the restrictions. The CDC director said today that she's, quote, really worried about states doing just that, given the number of variants out there. How would you respond to her?
I'd respond that we've been erring on the side of caution ever since May 20th, when we started our first reopening. And over the course of the next 6-7 months, the infection rate went down. We're following this very carefully, and we can change course as needed. But I've always said that our number one metric is going to be based upon capacity at our hospitals to make sure we have the ability to take care of people as needed. And 2, looking in terms of other governors in the region. And Charlie Baker's moving in the same direction for Massachusetts, and I think New York will as well.
And Governor, speaking of New York, I got to ask you this just because I know you're close with Governor Cuomo. You know there are growing calls for him to resign in that state from fellow Democrats. You want to weigh in on that?
Not much, but I can tell you he was a good partner for us as we worked through COVID, and still continues to be a good partner there. In terms of those other allegations, I can't speak to that, but I'm glad he's called for an independent investigation and make sure they get a full airing.
What about his position as head of NGA, National Governors Association?
Yeah, I think that's going fine right now. Let's let this thing sort out. I think the independent investigation will tell you a lot over the course of the next 2 or 3 weeks.
Thanks, Governor.
WTIC 1080 News.
When you went to additional age-based eligibility, the teachers and the school staff were the exception. Will there be other exceptions, such as the essential workers and the pre-existing conditions, who they were all hoping to be part of the current phase?
No, because I think we've tried to explain that from a public health point of view, age-based makes the most sense. From an equity point of view, we think age-based makes the most sense. From a point of view of getting the most number of people vaccinated we can to keep you safe, age makes the most sense.
And I guess I don't have a follow-up on that, but 1 year of doing this now, any thoughts on that? This has been a pretty intense year, and it's going to go on for a few more months at least.
Yeah, it was just about a year ago. You're exactly right. We were talking about the Surgeon General of the United States of America came to Connecticut on March 2nd last year, and he told everybody, don't wear a mask. It can be a bit of a distraction, and had us singing happy birthday while we washed our hands. So I think we've learned a lot about this virus over the last 12 months. I thank God we got a vaccine that's working, and it is making a difference.
The Associated Press.
Thanks, Max. Just to follow up on that last question, Governor, good afternoon. I think on last week you didn't entirely rule out the idea of maybe having special clinics for people that might be at high risk. Are you now?
We have no plans to change the allocation. We tried to explain, Sue, why I think this is the best interest of public health, best interest of reducing fatalities and hospitalizations. And I think we're moving fast in terms of the vaccines we're getting, so hopefully we'll be able to accelerate through this over the course of the next 2 months.
And you said that we're going to be setting aside 25% of the vaccine to 50 priority zip codes. I know in New Jersey, they're going to be using the J&J vaccine to go toward their equitability efforts, including sending them to emergency rooms in underserved communities to help the homeless. Are there any plans like that to use that allotment of vaccination for those types of purposes?
No, not at this point, Sue. I think you heard Josh say that right now our different health providers are making requests for the single-dose J&J or for the mRNA, so people will be able to go, say, online and select. We haven't chosen any particular populations at this point to separate them out.
Okay, and just one more question. You said also this morning that, and you just reiterated a little while ago, that it would take about 3 weeks to vaccinate this population, 55 and up. But I've spoken to people who did manage to get an appointment. They're pretty far out. They're like late April, May, and June, which is well beyond 3 weeks. So what should people do? Should they take those dates, or should they wait if they want to try to get a vaccination sooner?
I think if you've got a date, I would take that date, that's for sure. But I think we're going to find that we got the vast majority, the majority of the folks in the 55 to 64 that want to get vaccinated can get vaccinated over the next 3 weeks or so. But you're right, Sue, there are a couple of variables there in terms of demand and in terms of supply.
Yeah, if I can just also help build out on that. As I mentioned earlier, there are tens of thousands of doses that our providers are just finding out about right now in the last 24 hours that they're going to set up appointments for over the next couple of weeks. Some of our other provider partners, like our pharmacy partners, CVS and Walgreens, they don't find out what they're going to get until the next week. So they're only scheduling appointments about a week at a time. So if someone has an appointment booked out in, say, April, if you like that appointment, you want to keep it, great. I think the message is there's going to be a lot more appointments coming online in the next several days and weeks between now and March 22nd. So there'll probably be opportunities to improve your slot as well if you want to. Our request as a reminder for everyone is if you do find an appointment slot that's sooner that you prefer, please just remember to go back and cancel the old one so that someone else can grab it later on. Thank you.
Great. Thanks a lot, everyone.
The Connecticut Mirror.
Just to follow up on something that Sue asked, is there any talk at this point about pushing back the timelines for the age groups, given that some people have those appointments so far out?
I don't think so. I think certainly that would be premature. I think we're finding we are getting additional vaccine doses. Obviously, we'll know a lot more in the next week or so. And as Josh just said, I think you're going to be able to fill in a lot of necessary vaccinations over the next 3 weeks.
Yeah, and I think it's important to note too, like these phases don't begin and end cleanly on one day. They kind of bleed across each other, right? And our goal is to start the next phase at the point in time that we start to see slack in the scheduling. So for example, this past weekend, if you were 65 this past weekend, you could have gotten a same day appointment at a lot of our providers around the state. And so as soon as you start to see that slack in demand, that's when you want to go to the next phase, because the last thing we want is an appointment slot with a dose behind it that's not getting used as fast as possible.
Do you guys have a percentage of the 55 to 64 and education staff population that you expect to have been to have received their first dose by March 22nd when the next age group opens up?
So we had modeled it with an assumption that there would be about a 60% uptake by that date. So that's the planning assumption there.
And just to clarify, did you say the J&J vaccine is going to be directed predominantly to the teacher clinics, or where specifically?
So again, we didn't direct it anywhere. We asked our providers who would like J&J, who has the capacity to administer it quickly this week, and we fulfilled orders according to the demand. As I mentioned, there was actually quite a bit more demand than we even had doses available, so we took that as a good sign. I think a lot of the providers who were requesting doses do intend to use those for educator clinics, but there are a number of providers that are also planning to use them for additional opportunities for the 55 and plus community.
Thank you.
CT News Junkie.
Thanks, Max. This is kind of a Josh question, I suppose. I've heard anecdotally that testing is much lighter in some areas, like some places where you might have waited hours in the past, you can now just sort of go through quickly. But the numbers you guys are supplying they're not really dropping off. What might explain that? Is it heavy in some areas where it didn't used to be? What's going on there?
Yeah, Hugh, I think you're right. I mean, overall as a state, we're not far off our kind of all-time highs in the number of tests we're recording per week. We're at 278,000 tests over the last 7 days, which is quite a lot. Some of it may be related to the fact that higher education is back in. They do a lot of repetitive, kind of regular weekly testing of a lot of our college students who are living particularly on campus. And so that, there may be a little bit of a mix that's occurred there over the last month as some of the testing is being done at higher ed. It takes a little less going on at the kind of general public sites. But also I think, our providers, are continuously working on their processes, getting faster, getting better. So it's, but yeah, we are really happy that people are able to get tested and get their results very quickly right now.
Is there plans sometime in the future to sort of transition some of that, like testing resources, maybe to vaccinations? Or what's going to happen to the testing program as fewer people are tested?
Commissioner Gifford, do you want to take that one?
Yeah, COVID is going to be with us in some form for a while now. Even after we're all vaccinated, there's still going to be some level of need to think about COVID as part of our general health care. So I think we're in the position now of starting to think about transitioning a lot of these resources into more usual forms of caregiving, like we would with a test for influenza or any other kind of infectious disease. We're not there yet. We obviously still have a ways to go before we're out of this pandemic completely. But we do need to start thinking with our provider partners about what the next phase of this looks like, and that'll look more like a usual kind of a way that we would access healthcare. And to your point about transitioning, testing resources to vaccine, our providers have already been doing that. They've been using kind of some of the platforms that they had set up for testing to also integrate vaccines. So they've been hiring additional people and transitioning some of their testing resources, the vaccination program, which has helped Connecticut get off to the quick start that we have.
Okay, thanks. Governor, I was wondering, aside from what we've heard sort of publicly, have you heard any feedback from the Biden administration about, or the CDC for that matter, about your decision to sort of deviate from their recommendations to the age-based thing?
We had a meeting with the president via Zoom, I think on Thursday. He certainly gave a shout out to the state of Connecticut for doing a good job in terms of getting people vaccinated and emphasizing not just speed but equity. So I think we're, that said, I think the CDC is keeping to their guidelines such as they have them right now. But Hugh, I've heard from a lot of different governors who are thinking about how they can reorient their prioritization to make it simpler, cleaner, and more equitable.
During this meeting with the president, did you get the sort of impression that he's supportive of this change, or did he have an opinion on this change? What was your takeaway from him specifically about this program?
I'm not positive he was an expert on the Connecticut allocation, but I did get a chance to ask him a question broadly about how we were doing, and he spoke broadly about how the state of Connecticut is doing and what other states are doing as well to make sure we get this pandemic behind us.
Okay. Thanks, everybody.
The Day of New London.
Hello, Governor. We've heard of people today trying to get a vaccination appointment and being told by the provider that they couldn't give them the appointment now because they couldn't guarantee the second dose. Are you hearing that, or can you talk about how does that factor in? Do both doses have to be scheduled at the same time, and do they have the capacity has to be known at the time of the initial appointment?
Yeah, that's my understanding, Brian, is that you get that first dose and they have an allocated second dose ready to go that will arrive 3 weeks or 4 weeks later, so you know you have that second dose. I haven't heard any interruptions in that. Deirdre or Josh, have you?
No, what you just described, Brian, should not be happening. So if someone's got a story of having a hard time getting a first dose appointment scheduled, something related to the second dose, they should contact us or escalate. That should be.
I see. All right. The allocations that the state gets, a certain number of doses are designated first doses and others are designated second doses.
Yeah, the way the federal government does this is they deliver to us same number of Pfizer doses 3 weeks later to what they delivered, for that first dose of Pfizer, and 4 weeks later from Moderna. They just show up like clockwork. There's nothing we need to do. They've been arriving consistently right on time. So that's why I say there really shouldn't be any issues there.
Okay, thank you.
Connecticut Public Media.
Good afternoon. Some local health directors have expressed frustration to us today that they're now having to turn away age-eligible residents because the state directed local health districts to prioritize vaccinating school staff at their clinics. So is this the case? And if so, why this change in the mission for local health districts?
Do you want to try that, Deirdre?
Sure. So we talked to local health departments about how to handle clinics that they already had scheduled, and we were very clear that we didn't want them to cancel anybody that they had scheduled prior to the teacher and child care announcement. With respect to ongoing clinics, we suggested that individuals who could access an appointment outside of a local health department, that they do that. And that we did want the local health departments to work with their school departments and child care providers. But we did not make it clear that they should stop providing general vaccine eligibility and only vaccinate teachers. It's a little more of a blended message than that. And most of our local health departments are working with their school departments and child care providers and figuring out ways to do both.
Thank you. And a non-COVID related question. Last month, you told the Day of New London that the cost of the state PEER project had increased to $200 million. Now that an agreement has been reached between the city and the state, do you expect the state will pay for the added cost? And do you still support the project at this price point?
Yes is the answer to that question. I think it's good news. We're trying to finalize the cost of the pier. It's a pier that's going to be utilized by Ørsted and necessary to get the wind power going over the next 10 years, at which point New London will have its own modern state pier able to support a lot of other functions as well. So I think it's a good investment for the state and a good investment for New London.
The Hartford Current.
Hi, Governor. Eliza Fawcett with the Current. With many residents frustrated over not being able to schedule a vaccine today, why is it seemingly harder to make an appointment this time around than it was the last time that eligibility expanded?
I think you've got about 500,000 people that want to get vaccinated, and I know a number of them that are waiting around at 12:01 this morning to try and do it online. And that's why we wanted to narrow the cohort compared to, what could have been a much bigger group of people. And, as you heard Josh and Deirdre say, it's going to take a week, 10 days before you can get everything settled out and everybody gets there. But I think everybody that wants one will probably be able to get their vaccine, their first shot, over the course of the next 3 weeks.
Thanks. And then with regard to vaccine equity, are you requiring that vaccine providers administer 25% of vaccines to residents of these priority zip codes, or is that just a recommendation?
No, I want them to do that. I want to make sure that these underserved populations that are much more likely to be at risk to COVID get their vaccine. I know it takes a little harder, a little more effort sometimes to get the vaccine to these folks, but let's get it done. That's why we've allocated 25% to that population.
And are there specific repercussions if that 25% is not met?
There are no penalties, if that's what you're asking, but I think they know where we stand on the issue.
And then just lastly, do you have guidance for how providers can achieve that 25% administration rate?
The guidance is we're working with them, and we've got public relations going out, outreach, advocacy, working with the ministers, working with other trusted advocates, getting the mobile vans, additional mobile vans, so we can get the vaccines to these communities. So we're doing everything we can to help them get the vaccine to where the people are.
Thank you very much.
Hearst, Connecticut Media.
Good afternoon. Given the continuous increase in vaccine allotments for the state of Connecticut over the coming weeks, and do you believe the transition to the next age groups will go more smoothly?
I think more vaccines helps. More vaccines means more appointments, and more appointments means more people are satisfied. Right now we have a supply and demand disconnect. So yeah, Nick, I think more vaccines are going to make it easier, and I think you'll see progress on that over the next few weeks.
Thanks.
The Waterbury Republican American.
I think that could be about it, guys. Hey, Jason, first of all, thank you for joining us today and lending your insights on the vaccines. I thought it was really interesting. And I just want to say farewell to a great friend, and Bob Clark, who's been our general counsel here for 2 years. He's been appointed to be on the appeals court, so hopefully the legislature sees fit to have him there. He was previously a judge, as you well know. And replacing him is Nora Danahy. I'm really looking forward to her coming on board. I think you know her. She was in the AG's office, where she helped manage work with the general counsel here in the governor's office. She's also been in the Department of Justice and U.S. Attorney. Not many people can say they've been appointed by both George Bush and George Jepsen, so I think that's a pretty good recommendation. And thankfully, Bob Clark left her an amazing team of lawyers in the general counsel's office who have been extraordinarily busy with executive orders and the such. So Nora, welcome aboard. Thanks, everybody.